This will be a very short talk, and I think it's not too long because I want to hear your thoughts. We learn from each other, right? Okay, I don't believe in this whole old style doctor says something and you have to follow. I learn very much from biohackers. I learn very much from my patients. In fact, a lot of my patients actually teach me things and send me stuff which I love. Okay, and that's the way it should be. Okay, how do I do this? Okay, window. Oh, okay, cool. Right. Can you see that? Can you see what I'm showing? Maybe I put this on
Yes, I can see it.
This mode, right? Okay, this mode is better. So today I'll be talking about peptides, and whether it's longevity or health span or lifespan or whatever you call it. Okay, basically how to improve health, how to prevent disease, and also improve your lifespan at the same time. Okay, so before I carry on, let's have a poll, and I can't because I'm on my presentation screen. I can't really see hands and things like that. Just shout out, and say, how many of you have used peptides before? Yes.
Yes.
No.
Yes.
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 Yes. Cool. Okay. So, to those who have said yes, I think you can see, it's supposed to be a quiz anyway, but I think you can see the answers here. So peptides are actually short chains of amino acids, okay, just less than 50 amino acids, and they act like signaling molecules. So they signal organs, tissues, and things like that to do various things. Now, the first question that people ask is whether peptides are hormones. There are certain hormones that are made of peptides, such as insulin, growth hormone. Those are actually peptides, but not all hormones are peptides. Okay, right. Okay. So the endogenous, the peptides can be divided by two. Endogenous meaning that the body produces it, as I mentioned, things like insulin, growth hormone, or synthetic, okay, the man-made things like BPC 157, which I'm sure the two people who answered will probably be the one using this, or thymosin and many others, which I'll mention later on. So what they do is they go around the body and they bind to specific receptors on cells, okay, and they trigger pathways which then change, the function of the cell. Okay, often they're tissue specific, so which I'll go on later on, and so in a way, although it says here low systemic impact, they do have everything's interconnected, right, guys? It's not as if your elevated cholesterol will not have any effect on other things. They do, right? So, but in terms of actually, they act on the tissue, but what happens is that in terms of it doesn't act on every tissue. Now, so
yes. Can you switch to presentation mode so the slides are bigger and people can see them better?
Okay, wait. Let me try and do that. You're talking to a boomer here, so right?
Yeah.
Okay,
No pressure.
Okay, presentation mode.
I think if you click slideshow.
Yeah, I did that actually. I did click slideshow. Did you not see that? Oh no, I know what happens. Okay, wait. Let me do this. Okay. Okay. Show my screen. Is this better?
So
no?
The screen is being shared, but it's not full screen. So if you click, I think, slideshow at the top in the menu.
Okay. Cool. Okay. In the menu.
Yeah, go down to the right.
Go down to the right. Sorry?
Go one row down and to the right.
Yep.
To the right, slideshow, left.
Slideshow. Okay, cool. Yeah. Is that better? No?
Oh, we didn't change anything.
I think what's happening is he's sharing this view rather than the actual presentation view.
Okay. Sorry, really sorry. Okay. Right. Okay, stop. You can see me now, right? Okay, cool. So what I will do now is do this. Is that better?
Yes.
Yes, that's great.
Fantastic. Okay, right. Okay. Yeah, sorry. Yeah, I grew up in the time when cassettes were still working, guys. So sorry. And there were CDs. So okay, right. So there's high specificity. Okay, actually, in a way, although a lot of there's not. There are studies done in humans, but not extensively. Still, the animal studies and everything else shows that it's low toxicity. And they have short half-life, right? So basically, the effects are modifiable. Okay, next. Okay, so what do they do? Okay, this is what people want to know, right? I use a lot of not a lot. I do use BPC 157 for my patients, mainly for helping to grow vessels, angiogenesis. Okay, mainly people with gut issues, okay, and also those that have inflammation in their muscles and things like that. So, and I find it quite useful, okay. But there's other, so you can use it for regeneration and injury recovery, okay. Thymosin beta 4 is mainly for tissue remodeling. I haven't really used this that much. I can't really find this. And a lot of it is actually mainly research-based. Okay, thymosin beta 4. The other one is actually thymosin alpha 1. So you can actually help to modulate your immunity and also reduce inflammation. So LL37 is for antimicrobial, modulates immune overactivity, and immune priming and T cell function. The number of actually peptides are growing because of the use of AI to actually find them. So, which is amazing. But I think, that the science is going ahead while there are many of us, the actual usage of it, the kind of on the ground is being left behind now, and I will cover that later on. Other things that it can do is actually it can affect your metabolism, so it can control your metabolism, and this is one of the more famous ones. So GLP-1 RA. So does anyone know the name of a famous GLP-1 RA? Basically things like semaglutide, right? So Rybelsus, yeah. So which is already being used, in the market, right? I use it occasionally if I find that I need to kind of fast forward my weight control or my sugars going up and things like that. So I find one which usually a patient has left behind or not picked up and already has paid for it. So I just inject it into me. So nothing wrong with that. Okay, right? Yeah, they haven't picked it up. So they and it's going to waste anyway if I don't use it. So so GLP-1 RAs, amazing stuff, and I can tell you, a lot of case studies where I use GLP-1 RAs, and it's just amazing. I just reviewed the blood work for one of my patients, right? And it's not just the sugars; it's also the lipids, the ApoBs, their homocysteine. Everything's just going down nicely. When I put him on the GLP-1 RA. Although having said that, I also put him on a PSC90 KI, which is different. Okay, So the other thing is mitochondrial peptides. So MOTS-C, humanin, SS31. I haven't really used these. These are mainly, kind of like experimental for now. Okay, but allegedly they improve insulin sensitivity and stress resistance, which is amazing. Okay. Now, not really in this part of the world, but mainly in Russia, Eastern Europe, there are a lot of studies going on with Selang and Semax, okay, to improve cognition and brain health, all right, okay, to look at reducing anxiety, neuroplasticity, neuroprotection as well, which I think is quite important. Because if you think about it, if we age, there are certain things that we have to think about, things like, joints, bones, cardiovascular, metabolism, cognition, right? Memory. Of course, eyes, ears, speech, which is basically brain as well. Okay. Other things that I can do is actually try and optimize your hormones and muscle maintenance. So these are some of the examples that basically of peptides that stimulate growth hormone release, okay, which then helps to improve body composition, helps to improve, bone density and everything else. Now, so these are some of the examples here. So actually, do they work, right? Actually, they have solid preclinical data, right? Using cells, using animal models, everything else, it shows that it works. Okay, there is growing evidence in human trials, right? Okay, especially with VPC 157. One of my patients is currently using it. She's got inflammation in her lower gut, and she went off on holiday, and she was considering stem cells, and we discussed, and she said, okay, why don't I try BPC 157? And she did, and currently she's on holiday. She needs to be careful with what she eats, because otherwise she'll get a lot of symptoms. But surprisingly, 3 weeks away, or 2 weeks away now, she's eating, quite freely, and it's working. I don't know whether because she's away from Singapore or she's happy and things like that. But yeah. So we'll see when she comes back whether it continues or not. So thymosin alpha 1 definitely being used in cancer and hepatitis. A lot of athletes, people in this in this chat group, in this webinar, functional medicine people have also used this, and there are definitely case studies where it's improved. Okay.
Doctor, sorry for there is like a pop-up menu on the base which says stop sharing and hide. Can you please click hide?
Okay. Okay. Yeah. Sorry. Is that better?
Awesome.
Thank you. Sorry. So, oh my gosh, what happened here? Okay, never mind. This is my version of testing the eyes. Okay, so sorry. Now, I think and to be honest with you, I don't know why my photo was like that, and in the flyer, but I thought it was quite funny. But the title say, so why is it not being used so much? So actually, one thing is that peptides, okay, have been used for many years. Most of them, most of the people who have used them are usually bodybuilders and things like that. Okay, so growth hormone peptides, and that's a bad connotation with that. There's also lack of clear guidelines, and in terms of dosing, in terms of how it safety, in terms of how it is given. Okay, that's definitely lack of standardization, right? there's one of the slowest moving areas in the world in terms of innovation and adoption is actually medicine, because the whole medical world is built around, something goes wrong, then you make sure that it doesn't happen again, and you build layers and layers and layers and layers of protection, and therefore it'll take years before and they require clinical trials, blah 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 blah, and millions and millions and millions of dollars to invest. But the problem is that who's going to invest in this if it's not patentable and things like that, right? So I think this is an area that needs to be addressed. Okay, does everything need to be patented? Anyway, so, and they're considered somewhere in between drugs and supplements as well. So, should we use peptides? I am in the camp that says that we should. Okay, other practitioners may differ with my view. That's okay. That's life, right? So, but the thing is that I don't use it for every client. Okay, I will use other methods as well. I'll look at the data, the biomarkers that the patient presents with, and then say that, okay, you've tried this, you've tried this, you've tried this. Okay, as an example, the patient is currently on holiday away and taking BPC 157. She's tried everything under the sun to control her kind of like, what was it called again? Ulcerative proctitis. Okay, yeah. So she's trying everything. So we say that her biomarkers clearly shows that it is an inflammatory, kind of reaction. There is some breakdown in the gut barrier. Okay, so and we say, look, you've tried all your probiotics, you've tried all these things, blah blah blah. Let's try this. So let's see when she comes back whether it really works. So I don't use it as a first line. I will try other things first, things like your lifestyle, your supplements, your other things. Then that doesn't work, then we try this. Okay. I usually start low dose. Okay. The problem is that you don't actually can, because of the non-standardization in terms of dosing and quality and things like, you don't know what each capsule has. Okay, and that's an issue. Okay, so I start with basically something like try one capsule a day, and then bring it up. Okay. That's I really find it very hard to find reputable supplies. Okay. Now, I think so. My personal take is that it's not a cure for everything. Okay, but there is I think an opportunity for peptides to play a larger role in longevity management. Okay. So the future of peptides, I mean, the future of longevity medicine is quite exciting, and AI is driving a lot of this. Personally, after setting up now, I would say 3 different models of longevity clinics. One being a high-end, one being something that's combined with a gym, and my current one, which is in primary care. I don't think the future of longevity is in clinics. I think the future of longevity should be something that you can do as easy as breathing air and using AI to guide you, or some sort of platform to guide you in terms of your own stack or by kind of like supplementations, right? The other thing that I think will be quite exciting, because now you have to take it orally, and then, or you can inject it. The thing is, it goes around the body, but what if you can target it to the actual organ? So that's the other thing. And currently I'm looking into combining, not epigenetic reprogramming, that's in the future. mRNA also in the future. Okay. But combining with stem cells and exosomes to actually see whether it can be, the management can be stood up. Okay. So, and of course, better regulation. Yeah. Okay. So, in conclusion, I think, you can do this. I think it is something to consider. Okay. But we need better access, more science. I think people who are, say, not really ethical, but ethics is important. But I think people who can guide the whole sector to ensure that there's no like snake oil, okay, being put into this field. You need to contact me, please. This is my email. If I don't reply, that's only because some spammer is sending like 700 messages to my email in a day. I'm working out a way to actually stop this tsunami of emails from this one particular bot. But anyway, happy to answer questions at 10:30 on a Tuesday night. Okay. I'll stop sharing here. Oh my gosh, what happened here? I'll stop presenting. There you go. Right. Bring it on. Okay.
I can go first if nobody else has
Kevin,
one.
yeah.
My question is, I'm really new to this. I've never taken any. Can you just, it's kind of a naive question. Can you just take a bunch of them, or do you have to target like one at a time? Can they counteract each other, or is it just better to do, one?
So it depends on what you need. So what's your focus area? So if it's basically joints or gut, then you take PPC 157. If it's other things, you try, I would say that, you start small, then you stack it up accordingly. Okay. But, make sure that you know your symptoms, right? Or your status. Okay. Any side effects whatsoever, because these things can have side effects, right? Just mention them, write them down and things like that, and then try and tail back. But I do take sometimes PPC 157. And people give me a lot of samples of peptides which I take. So far, I'm like, I don't know whether this actual peptides or what. So far it's okay, and my biomarkers are okay. My biomarkers are fine, apart from my gamma GT, which has always been like for 30 years, slightly elevated.
Okay.
Yeah. So that's Martin. Yeah. Sorry, Kevin. Yeah, please.
What if I don't have like a symptom I'm after? I'm just trying for like going after longevity or just more optimal health in general. Is it better to stay away from peptides until I have a symptom or specific?
Oh no, you don't need to wait for symptoms. But currently, it's there is no one one that rules them all. No one peptide that rules them all. So it's actually categorized. A lot of people say you can take this for everything, and I don't think that's quite true. Okay, because they are specific. They're targeted specifically for certain cells and certain kind of receptors.
Okay, thank you.
Yeah. Martin.
Hi there. Thank you
Hi.
for the presentation. I just wanted to ask: is there any one specific vendor of the peptides that you would recommend? Because I've seen a lot of offers, and to be frank with you, I do import a lot of stuff from China mainland, and the price per kilo of the peptides is really ridiculous. So I want to be sure that the price I'm paying for is really worth.
Yeah. So I also get a lot of my peptides from China, but here's the trick. Okay, you have to be buying it from inside China, because if you buy it from inside China, okay, as a Chinese company or vendor, you use a friend there or whatever, the quality is so much more different. What they export, the quality is slightly lower. Okay, so but I also take it from China. The only thing is that it's very hard for me to know the quality or kind of like validate what they say, right? In terms of that. That's the only problem I have. That's basically it. It was because of the price point as well. Okay, but what I do is I get a friend who runs a clinic in Suzhou to buy it for me.
Okay, thank you very much. One more question. I've asked us several questions over the chat. One more question.
Okay, sorry.
Related to Selenmark, Semark, because I've seen in the presentation that this is mainly about improving cognitive functions. How is it compared to C8 or MCT oils compared with racetamide?
So I don't think there's any studies to compare per se. I don't have any patients who have taken that. So I think we need to wait for the data to actually see that. But I'm quite excited about this. I know about C8. I haven't really used it. But I think I'm a bit more excited about Sema rather than C8. Yeah.
Okay. Great. I will look at it. Thank you.
Yeah. No problem. Okay, I'm going to go through the questions as well. There's AI chats. AI. Okay. Okay. Someone. Okay. That's Dr. Sandeep. Yeah, he left. Is it? Okay. Yeah, Raven.
Okay, so if anyone else doesn't have any questions, I want to ask some. The first one is, can BPC 157 specifically help with gut lining damage?
Yes, actually, studies have shown that it can, and I've actually used it for a number of patients with gut lining dysbiosis, right? Now the only thing is that of course, this is my patients. I don't have a control. It's not a proper study in my clinic setting. But so far, I would say about 90% of those it's worked. Yeah.
Can you pair it with PPIs?
I don't see why not. Yeah, I don't see why not. Yeah. Proton pump inhibitors, right?
Correct.
Yeah. No, I don't see why not, because the mode of action is different.
So ideally, let's say if the best way to track would be, let's say you do an endoscopy before you start the peptide and PPI, and then you run both together, or you run one for a while and do another.
Okay, so if you want to do n equal to 1 experiment, then I would say this is how you do it. Okay, so you take all your GI map, all these things. You do that, right? You take all your basic inflammatory markers and things like that. Then you do your scopes. You see what's the baseline there. Okay. Then what you do is actually, I would say, start the BPC 157. okay, first, right? Okay, see how that goes. I would say maybe minimum 3 months, 4 months. Okay, this is on top of my head. Okay, then after that, if you want to, you add on the PPI to see whether there's absolute improvement or not, right?
Mhm.
Yeah, I think that would be a good way to do. Or you can start the PPI, but PPIs usually work upper GI, whereas BPC 157 works throughout, right?
Awesome. That sounds promising. The second question I had is what peptides can help with muscle growth and what can help to improve neuroplasticity?
So neuroplasticity, I think I mentioned two, but that I am quite excited about. Okay, so they're actually, let me see, this is the problem with 1030 Selang and Semax. Okay, neuroplasticity mainly Selang. This is mainly found in being researched mainly in Eastern Europe, in Russia side. Okay. For muscle, I would say that once again, okay, soft tissue BPC 157 is quite good. Thymosin beta 4, I have no. Some people say it's good. I have no real kind of experience with it. Okay, and that's it really. Yeah, you don't want to use things like GLP-1 arrays for muscle because they actually can reduce your muscle content. Okay. Some people say that the new ones, the things like CJC 1295, they can actually stimulate growth hormone release and therefore improve on muscle. I have no experience with CJC 1295.
Awesome. Thank you. Thank you so much, doctor. I had one last question.
Sure.
That would be GLP-1. Let's say for obese and elderly patients, if they start off with like 3.5 oral at first and then they stick to 7, is that considered to be like a normal dosage, or it's like higher than what they should be doing or lower?
Okay, so we're talking about things like the oral one, right? The oral, GLP-1 RA. Okay. Okay. I full disclosure. Okay, I'm actually one of the advisors to Novo Nordisk for Southeast Asia for Rybelsus. Okay. I can tell you, we in the advisory board, we don't even bother with 3.5 milligrams. 3.5 milligrams is nothing. Okay, it's a marketing ploy. They ask us to pay the same price for 3.5 milligrams for 7 milligrams, which is the same as 14 milligrams, same price. So what I do is actually I start my patients with 7 milligrams. Okay, then I give them a formula to follow so that they don't get the side effects. Okay. Then after that, you take it alternate days first to get your body kind of get used to it. Then you use it for about 7 days to 14 days, alternate days. After that, you go to 7 milligrams straight away. Now, the key to using GLP-1 RA is this, okay, the oral one. Do not eat or drink for 30 minutes after waking up. After that, you take the the pill, you take it with a bit of water. After that, nothing for about 30 minutes at all. After that, you can have a bit of breakfast, a bit of breakfast. After that, it goes up. The key is that it will cut off your glucagon kind of mechanism. So your brain says that it wants to eat. Your stomach says, no, I don't want to eat. It's a very strange feeling. You listen to the stomach. Okay, otherwise you'll vomit and everything else. So that's how you do it. Okay, there you go.
Awesome. Let's say when you take the GLP-1, can you take probiotics with that, or you would
Oh yeah. But you don't take it the same time. You take it later on. Yeah.
Later on. So let's say you take the GLP-1, 30 minutes later you take the probiotics, and then 30 minutes after that you eat something. Does that?
No. You take the GLP-1 RA. Okay.
Mhm.
Noontime or afternoon time, you take your probiotics. Okay.
Okay. Okay. Thank you, doctor. I think Lauren had a question.
Yeah. Lauren. Yeah.
Yeah, thanks, guys. I was wondering about BPC 157 and like for joint injuries, like because I know that people usually use it like as subcutaneous injections, but I've also heard of people doing like peptide injections like directly into the joint, and I wanted to know your thoughts on that.
I've never done peptide injections. I've done. I know some people who have. Okay. I have never used it. I do joint injections. I use PRPs. Okay, plasma-rich platelets, and other things that I put in. I put in stem cells as well into that. But yeah, I don't have much experience in injecting peptides. Yes, technically you can inject a peptide into a joint. Okay, yeah. The only thing I would be worried about injecting into a joint is high doses of steroids. Okay, which we want to avoid, and also analgesics as well. Okay, no, not analgesics, anesthesia. So some doctors they do that, and when the doctor says that he wants to do, or he or she wants to do that, say no. Okay, it's not the best thing.
Yeah, for sure. So for the injury healing that you've been working with BPC 157, that's usually like orally, or that's just kind of like subcutaneous injections that are just like generally help?
Subcutaneous and oral. Yeah, I try, although it's okay, there's no science to this. Okay, just basically, kind of a placebo effect for the patient. I try and put it as near the joint as possible, but that's not how it works.
Okay, awesome. Thank you.
Yeah.
M has some questions.
Yeah, Sam, how are you, man?
I'm doing good. Thank you for the super interesting presentation. And I'm just very curious if you don't mind sharing, because you mentioned you have tried BPC 157 yourself. So I'm very curious to hear about both your anecdotal experience and also like any biomarkers that you have observed changing as a result of that.
You see, the thing is, I get sent a lot of things, and I take a lot of things. So sometimes I don't even know which ones have changed my biomarkers or not. I just can't much track of. So the in terms of how I felt with BPC 157, to be honest with you, I didn't really feel anything much really. Maybe yeah. And I didn't really take it that long. I took it for about 2 weeks, stopped, and then recontinued again, which is not the best thing to do. But my patients, but talking to my patients, especially for gut, it seems to have solved or helped modulate some of their symptoms. But for me, I didn't really feel much, really. Yeah. Anything, but then again, that's subjective, really. Yeah.
Yeah.
What about you? Have you tried?
I did, and I had a pretty similar experience. I was taking it for maybe like 4 weeks total. I didn't feel much, so 2 weeks in, I doubled the dose, but still, I didn't really observe any difference.
Yeah, so I think, I don't know. I mean, if I was going to do an experiment, I would say I need to clean myself away from all my other supplements and other things that I take. So I take a lot of things, unfortunately, sometimes. Okay. I do take rapamycin. Okay. I do take metformin. Okay. I sometimes inject myself PSC9CKI and also GLP-1 RA. So I think I need to clean myself first. Okay, wait, and then put in my BPC 157, do my biomarkers, then BPC 157, and then do that. But I think I have to think about what biomarkers I need to do probably interleukin-6, probably HSCRP, ferritin or something like that. I'll have to think about the biomarkers. Yeah. Does that answer your question?
I guess it does. Thank you.
Thank you. Okay, why are any peptides so expensive here? Actually, I also have no idea why it's so expensive. Yeah. And what else is there here? Okay. I don't know. Yeah. Okay. Yeah. Any other questions? This is very unusual for a group that, when I open Telegram, has like thousands of messages.
If nobody else, something else. So based on like the hype that peptides are getting lately, is it actually as effective as like drugs, like in compound?
So I think there's somewhere between drugs and supplements. I think you need more data, right? But yeah, that's the only thing. Yeah, but I think it's going to be very hard to push the industry to actually do research and things like that, because let's put it this way, they want to make a buck, and if they can't make a buck out of it, they're not going to put any money in. So it's up to people like us to see. Now, the only thing is that now we need to find reliable sources, good quality sources. That's the challenge. Yeah, but yeah, I use China. Yeah.
Does anyone have any other questions? Yeah, I think nobody has a question. Then I can probably poke your brain a little bit more.
Sure.
So another thing I was wondering is, at the end of the day, if it's something that's more powerful than supplements and it's not heavily regulated, that means there is enough opportunity to capitalize on that. And I'm assuming, naively assuming, that probably the production methodology is not that difficult. I heard that in Thailand they're making it. In Malaysia, I've heard that some people are making it local, like in DIY labs. So it shouldn't be that hard. And why isn't any big corporation picking it up? And like, supplements are a huge industry. There's so many snake oils. Why isn't peptides replacing that yet? Or at least like adding a layer on top of that?
Okay, give it another few months, give it another year, and someone brings it up, some influencer or something like that, and then everybody will get kind of excited about it. So at the moment, people are on the tail end of supplements and things like that, right? Well, from what I can see anyway. But the thing is, peptides per se, I think there is a big opportunity. I don't know about the production. I'm not a pharmacist, and I wouldn't dare call myself one. But I think that there's definitely a big opportunity there. But I don't think it's it justifies the cost, right? The fees that people are asking us to pay. So because I don't know how it's made. But apparently it is easy. Apparently, yeah.
Fair enough. I guess it's time for any biotech entrepreneur to just step in and capitalize.
Yeah. You want? Yeah. I'm not going to say anything, because I'm not going to say you want seed funding. Yeah, but yeah, because otherwise I'm going to put my put it.
Cool. But Chris typed a question in the chat in one of our groups. I don't know whether he's here now or not. He can ask those maybe. Chris? Hello?
Yeah.
Ah,
I
okay.
didn't have anything in the chat, but I had some earlier questions. I think they've all been answered, actually.
Okay.
that I had posted earlier. Yeah, I think you covered all of my questions. Thank you.
No problem at all, Chris. I find it very hard to juggle between Kakao Talk for Korea, Line for Japan, then WeChat for China, and then Telegram and Discord and everything else. But I think looking at the chats, you guys have a lot of chats, but they're quite interesting. And so I hope to be more involved in the group.
Well, actually, yeah, I did have another question. Thank you. So I was experimenting with nasal spray of BPC 157 and TB 500, and I was, I guess, using like some human benchmark and a real me, brain cognition biomarkers, and I didn't really see any changes, but I only did it for a month. What would you expect? Like maybe take a month off and then repeat more, or increase the dose, or maybe you wouldn't find any biomarkers changing.
You tested the brain biomarkers, right?
Yeah. Memory, reaction time, aim test, things like that, eye-hand coordination.
Perhaps you can try again, but test other biomarkers that's more for inflammation rather than the brain. This is just just a suggestion because BP 157 does have some effect on the brain, but not that much.
Okay.
Right? Mainly for it's mainly for the gut and for inflammation, soft tissue, and things like that. Yeah.
Okay. Now, if I was having brain fog, would you expect that to get better using BPC 157?
No, I don't think so. No.
Okay.
Yeah. I don't think so. Yeah. Has anyone tried ketamine? No, I shouldn't say that. Has anyone tried not ketamine as in but microdosing for neuroplasticity? Yeah? No.
No. I do microdose with psilocybin, and I hope everybody saw the recent article linking psilocybin use to longevity and cell viability. Hope everybody saw that. Very interesting.
Yeah. So I am quite interested in the use of microdosing of certain molecules for neuroplasticity and cognition and things like that. But the only thing is that I live in Singapore, which is
right.
Yeah. I'm sure they're listening in here, so I won't say anything. Yeah. Okay.
If anyone else doesn't have any questions, then maybe we can do a soft conclusion.
And if anyone wants to know how to put an IV into yourself, I'll do a workshop next time. Sorry, just a joke.
That would be awesome.
But I know how to do for me.
I mean, if everyone can do that, that would be the next frontier of biohacking.
You have to set up your IV line first. Okay. Right. Okay. Well, thank you very much, everyone, for spending the night with me and a few hours of the night. And thank you for the questions. And Raven, thank you for inviting me. Sorry about last week. Yeah. Okay. But thank you.
Thank you, Dr. Hisham, for making time so late at night for us. Really appreciate the insights and the answers and your time.
No problem at all. Okay, anytime. I'll try and catch up to the chat in the Telegram.
Okay. Is there an for the people if they want to follow up with you? Where should they find you?
Oh, they can just Telegram me. Yeah, I mean, I'm okay. Or they can just email me. It's I'll share my slides with you, Raven. Okay.
Awesome. Thank you so much, Doctor.
Okay. Cool.